Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the host of the Dean's Chat podcast and the dean at the Arizona College of Podiatric Medicine. It's my pleasure to bring back my 2027 class representatives for Dean's Chat. We've been following them along throughout the entire first year of their education. And my hope is that we'll continue this for an entire 4 years, and we'll be able to have a playlist of your entire educational experience. So this is our third episode. First episode was, I think, 53, and the second one was 88. And if you think back, when we first met, you'd only been in school for a few weeks. That was a great episode.
Pretty crazy to think of, huh?
It's very crazy. So let me introduce everybody back again. Zachary Anderson, welcome back.
Hey, how we doing?
Audrey Diaz, welcome back.
Hi, thanks for having me.
Austin Benally.
Hello, nice to be back.
Welcome back. And Rineeta Lahiri, welcome back.
Hi, thank you.
Oh, this is great. I'm so excited to have you here. It's the middle of summer. You finished up your first year. You're already into the beginning quarter of your second year with lower extremity anatomy dissection lab. But I thought the first place we should start is kind of a summary of the first year experience. And remember, who we're talking to is prospective students that are considering coming to the Arizona College of Podiatric Medicine. And in the big picture, we'll have the entire continuum. So with that in mind, Audrey, do you mind starting? Can you give us kind of a synopsis of the first year?
Yeah, of course. So we took a lot of basic science courses, and we learned a lot of things. I did not know that I could learn that much in such a short amount of time. But I've had a really great experience meeting a bunch of new friends and taking our basic podiatry skills course. Now I know a lot more about the field of podiatry than I did coming in. And definitely a lot of studying, but the closer that we get to graduation and everything, even though it's far away, we've just learned so much more about the field and what we're eventually going to be doing. So it's been really exciting.
Very good. And I imagine you've all learned a lot about yourselves and how you study and how you can be successful and maximize time and things like that. Rineeta, what's your experience been?
Well, it's definitely been hard since first coming here because it's very different from undergrad. It's a lot of information all at once, and you're kind of learning how to study. And like you said, we learned so much about ourselves. Like, I feel like I've changed a lot in the way I study just to be able to acclimate to the amount of content we're getting each day. So, but in the end, it's all worth it. It's been a lot of fun.
Very good. Austin, what's your experience been?
Yeah, so I would have to agree with what's been said already. It's been a great learning experience, growing, like figuring out how far I can push myself, but it's been great. I've enjoyed every day. And this summer has been amazing because it's kind of like the culmination of everything we've been working towards, and we're really starting to see what our end goal is and what we're going to be doing for the rest of our lives. So it's been great.
Fantastic. Zach, your thoughts?
Yeah, I mean, I've had a great time. Like, I mean, in undergrad and just kind of before you start med school, like you kind of just tell everybody oh yeah, I'm going to go to med school, be a doctor. And then when you finally get there, you're finally like, oh, like we're in it now. Like you got to really work your buns off to be successful and be the type of doctor you want to be. So it's just a great experience. Like it's hard because it's supposed to be, right? If it was easy, then nobody would get better because there just wouldn't be enough smart people being doctors. But it's like I said, it's hard because it's supposed to be, but you need to have fun doing it. Just because it's hard doesn't mean like you should not enjoy it. Like that was kind of like when we were first starting like school and stuff, I was just like, oh, I'm like, man, this is tough. Like I'm just not having any fun. Like I'm gonna learn it because I need to know it. But once I kind of figured out like, hey, this is hard, but let's make it fun. Let's study in like a more fun way and stuff like that. So I've kind of just figured out like you gotta just enjoy the grind.
Very good. You know, I was doing some interviews today with students, and it seems like a very common question I get asked is necessarily about our curriculum, but about the quarter system, because many students are coming to our school and they've been on semesters and they always want to know what the quarters are like. I was wondering if each of you could just comment on the pace of quarters and your take on it. Rineeta.
Yeah, so I had a similar experience. I did go from semesters to quarters. It was definitely different because now we're putting basically the same amount of content, but in 10 weeks. And actually, it's probably triple the amount of content in a much smaller amount of time. But at the same time, it's kind of nice because we spend a shorter amount of time going very in depth on one topic, but then we move on to the next one and we just keep learning, and it kind of keeps it fresh.
Very good. Austin, your thoughts on the quarters and what it takes to not fall behind?
Yeah. So it's funny that you brought this up because I was talking to Dr. Wisman about this, I think on yesterday. And I was telling him, like, in undergrad, we go for like 15, 16 weeks, and it gets like really monotonous, and you get really worn out, and you're kind of bored of the courses. But here at AZCPM, it's great because you don't really have that monotonous, like really drawn out semester system. It's really nice to kind of change up the courses, get new faculty in the mix, and kind of restart. So I've loved it.
Very good. Thank you. Zach?
Yeah, I mean, I really like the pace of it. Like, I like the fast-paced stuff where you got to learn it and then you move on to the next topic and then store that information for later. So I think the quarter systems really allow, like, the school to provide you with the most information you need before you take board exams and before you go out on rotations. So I think, like, the quarter system kind of provides that fast pace that's really, really helpful for students.
Oh, I agree. Audrey, your experience and how you didn't fall behind.
Yeah, so I thought that the quarter system has been really beneficial to me because during a semester, it's a little bit too long of a time where you might have an exam like once a month or something. And sometimes that's too much content and that's too much time. And so we have exams once a week. And I kind of like that because it makes me stay on top of my classes because our exams are relatively frequent just because it's a quarter system. So I've really enjoyed that. And I do think that it helps you kind of stay with the content and always like keep studying for your next exams and not just kind of like, it doesn't really allow you to relax too much, but I think that it's just the perfect amount.
Very good.
It's nice too, just to add on to that, because everything just builds off of each other, right? Like in our first year, we just did straight general anatomies from head to toe. And then now we're more in our advanced lower stuff. So we get to just build on to that previous information we had. So I think the quarter system really helps you kind of develop that process of building on to the previous knowledge you have.
Well, we've tried over the years to design it that way, right? So that things feed and things build up. So I think that's good to hear also. You know, all work and no play is no fun. And I always tell prospective students that when you come into a quarter system, you work really hard and then you get some time off to recharge your battery a little bit. I was wondering if you could share with our audience the kind of fun things you do between quarters. Austin.
Yeah, so I've been having a lot of fun going out on trips everywhere. So our last break we had, I went out to California, and that was great. So I got to go up and down the coast. I was in San Luis Obispo, Monterey, and just taking tons of photos and taking everything in. So it was great. Yeah, but it's so nice to have those breaks, just recharge, and then you can come back with your battery full and just give it your all again. It's really great.
It's a good cycle, isn't it? Very good. Zach, what you been up to?
Yeah, I mean, the breaks is kind of the perfect time to kind of get your personal life in order, right? Like if you need to do any doctor's appointments or anything like that you don't necessarily have time to do in school, it's a good time to do that. And then it's also a good time for your pleasures and stuff like that, right? Like I'll take a trip to Las Vegas with my friends or we'll go on the golf course and stuff. So it's really just a good time to kind of do the stuff that you don't get to do during the school.
Absolutely. Audrey, have you made any big trips or done some exciting things?
Well, recently I went up to Flagstaff and I've also been to Sedona. I've been trying to explore Arizona a little bit. There's just so many beautiful places to go here, especially as it's so much warmer now. Flagstaff's really nice. And so I've just been trying to get outside and enjoy everything that Arizona has. I mean, it's really cool that we're only like an hour and a half away from beautiful mountains that are like 75 degrees, 80 degrees over in Flagstaff. So
Yeah, students are shocked when I tell them in the wintertime you can go skiing just 2 hours away up in Flagstaff because they don't think of Arizona and equate it with skiing at all. But by the same token, they can go down to the Gulf and it's 3 hours away, Rocky Point. So there's a lot to offer here in Arizona. Rineeta, what have you been doing for fun on your breaks?
Well, I definitely prioritize going home as well for at least a portion of the time and then spending the rest of the time with friends here. And then I have been getting more into road trips recently, which have been very nice because it's just nice to get in a car and just drive somewhere to see something. And there's not always like a goal in sight. We might just find something amazing. Like the other day, we just went on a long drive and we found a bunch of metal dinosaurs in someone's backyard. And that was probably the highlight of my whole week.
Oh, on those road trips, what's your music of choice?
Oh, I try to keep everyone happy. So there's a mixture of pop, and then unfortunately I do have to slide some country in there. I'm not the biggest fan, but I am getting more used to it.
Very good. So back to the academic side, talking to students as they come into the school. We talked a little bit about time management and not falling behind on previous episodes, if you will. But let's talk a little bit about the courses themselves. And if you don't mind each taking a different course, perhaps what was the hard part of the course? And what would you recommend to students taking the course and how to keep up and do well in them? Feel free to pick the course of your choice.
Yeah,
Zach.
I don't mind starting. Yeah, so I think one of the biggest courses that AZCPM offers that not most of the other schools offers our biomechanics class. You know, Dr. Toms does a great job of just doing the biomechanics of every single joint of the foot. Because, you know, as surgeons and podiatric physicians, you need to know like the different planes of motion and axes of motions and how they affect gait. Like we talked about how the foot's just a great mobile adapter to a rigid lever in a split second from our heel strike to contact. And so I think the biomechanics class that Dr. Toms runs is a great class. You know, it's like we do lots of physical tests. Like that's the first class where you have your observed clinical skills exams and you do all your subtalar joint neutral position and stuff like that. And so that's kind of a good way to kind of get introed to that stuff before we do our main like practice patients and stuff as 3rd and 4th year students. And just overall, that class is just a good way of kind of pairing the anatomy of the foot with all the biomechanics and physiology of the foot. So I think that's a great class that we offer.
Well said. Audrey.
Would you prefer a course that we're taking now or a course that we took it from the beginning?
Well, why don't we talk about a course that you took during the first year, and we'll talk about courses now after.
Okay, so I would say that one of our largest courses is general anatomy, especially the first quarter. I believe it's our highest credit hour course. And that one was kind of tricky for me at the beginning. It's a lot of nerves, it's a lot of muscles, attachments, and just a lot of brute memorization, honestly, but it's extremely interesting. And if I could kind of redo it, what I would do is I would probably have spent more time in the lab, more time understanding the relationships to the structures, but it was a great overview of everything and learning all of that good terminology and understanding the processes. And so I really enjoyed it, but it was definitely one of the harder courses that we took.
You know, it's funny because when you start here, the first week you go through orientation, then you start classes, and then all of a sudden you've got exams staring you. Recommendation for not falling behind in anatomy.
So with anatomy, I really don't feel like you can let yourself fall behind because it's a lot of memorization of nerve and spine levels, which don't really, there's not very many like super easy, quick tricks to memorize every muscle's innervation. So I feel like going to lecture for anatomy is good, and definitely you have to go to your labs, but spending a good bit of time in the labs, I do feel like helps you on both like the written exam and the practical exam. So that's what I would have done.
Great advice. Renita.
I'll actually take our podiatric surgery class because I think that's definitely a benefit that we have. My favorite
There you go.
My favorite part of that class is that's the class where we started to learn how to suture. And I had only ever really played around with a suturing kit, but in that class we really do dive deep in building up speed as well as precision, accuracy. We want to make sure we give our patient the most precise and aesthetically pleasing stitches because they do have to look at them as they go about their daily life. And we just dive in more into the surgery aspect because we do have our 3-year surgery residency. And it's just a really good intro, as I do know we have another surgery class coming up.
3 of them.
Yeah, 3 of them. And Dr. Kraleski just does an amazing job going through each little part and making sure we truly understand it. So as for advice, I really do think you want to go to our labs, go to all the possible lectures that you can, because Dr. Kraleski just explains everything so beautifully, and it really helps to go to lecture and get that content firsthand.
Well said. And, you know, having started a residency and been a clerkship director, I can assure everybody that the better you can sew, put in sutures, be efficient, the more work you'll get to do as a student and a resident. So that's kind of the first hurdle, if you will, for being past the blade when you start doing your rotation. So practice suturing as much as you can, and great advice. Austin, what's your experience from the first year in one specific course?
Oh, man. I'll probably talk about physiology a bit because that was an interesting course for me. I was very much used to like brute forcing the information from anatomy and even biochemistry, because there's just so much you have to memorize sometimes, and that's just the way it goes. But it's so important to have that foundational knowledge. But I loved physiology. At first I didn't, but it's because I was just getting used to thinking in a different way. And it really makes you think in that clinical mindset of something's changing, then we have to consider the downstream effects, and it makes you think more holistically, kind of, versus that more discrete, like we're doing neurology this week and we're doing muscles of the upper extremity this week. You kind of have to integrate everything, which is also a big segue, I would assume, into second year, because I know everything's coming back and we're going to be in that mindset again. And even with some of the stuff we're doing right now, like our podiatric basic skills type courses, that you really have to be in that mindset of considering a lot of things at once to kind of build a full patient. So I really enjoyed that course. And if I had any advice for staying ahead in that course, I would probably say just don't put it off. Just kind of stay in that mindset as much as you can, especially through any course. If you can integrate information from any course, you can kind of build a bigger map and everything just fits together better. And it just makes you a better student and physician one day.
I agree with you. Something that just crossed my mind is let's talk about at the end of the day, and not the end of the day yet, end of first year. What were your study habits that worked compared to when you came in the door at the Arizona College? Audrey.
So when I came in the door, I realized I didn't really have like a specific study routine. And I was just I would kind of go to lecture and read my textbooks, but I didn't have something super specific that I did. And I realized everyone was talking about study strategies, and I had never thought about that. And so I just decided to write everything down, and I still do that. But it is interesting to see that you do kind of have to pick a study style and really see what works for you.
Absolutely. Rineeta, you can turn that your way. Yeah, there you go. Yeah.
Yeah. So for me, I was kind of in the same boat. I didn't fully know how to study, and just hearing everyone throw different strategies, it got a bit overwhelming. So I, like Audrey, kind of stuck with rewriting my notes, and it does help the information stick in your head. But then I found that I just tend to take so much time writing my notes that I did end up changing my strategy. So now I more so go through slides and writing my own notes in the margins. And if it is a more difficult topic, then I will write out everything and make sure I'm covering the important parts. But it's also picking and choosing, because, again, I am a slow studier. So I want to also be able to maximize my time, making sure I'm getting the content that I need to know.
Absolutely. Good advice. Austin?
Yeah, so I kind of did a hybrid method when I first started. So I did a lot of note writing, but that probably took me about at least 2 hours per lecture, which wasn't necessarily the most viable thing for me. I think I was getting too caught up in the small details, which is a big pitfall I think a lot of people make, because we have to move fast with all the content we're given. But I've retained note writing a bit, especially if nothing else is working. Sometimes just writing it out helps you organize your thoughts. And let's say you're sitting outside the testing center right before an exam, you can just pull those notes up real quick, and you can mark all those high yield. I have a whole bunch of symbols I put next to high yield stuff, and I'll make even shorter, more condensed lists sometimes. So it just maximizes that time. But the biggest thing I've been doing is flashcards. So I do a lot of Anki flashcards, which I know a lot of the upperclassmen do. But the reason why I've been doing that is I've kind of been cataloging everything since day one for boards. So one of my friends, Brian, actually has been helping me write the decks for this summer, because we didn't really have established decks. So we have a pretty big library of information right now, and we've been tagging all the really important stuff that professors have been kind of hinting at will come back for boards or in clinic. So we can just type in a little tag and it'll come up. So like a big one this year for like pediatric orthopedics or even imaging were ossification centers. And I always forget those, but we tagged all those cards, so you can just type in ossification centers and they'll all come up and you can just review them real quick. So I really like that organized approach. So that's what I've been doing.
Seems like a process is the way to go for sure. Zach, what's your
Yeah, I
experience?
mean, the biggest thing that I would recommend to any student is like when you study, you have to be doing a form of active recall, whether that's Anki decks or just flashcards. Or I know some people will like take a lecture slide and then like black out all the words and then try and memorize it that way, right? So it's really just the active recall of, hey, when I get this topic of whether like Paget's disease or hyperthyroidism and stuff like that, where you know, okay, I know that it comes with sclerotic bone lesions and diffuse bone lesions and stuff like that. That was just an example that just came off the top of my head. But it's just the active recall of, okay, when I'm talking about whether it's just general anatomy, if like we were talking about your neurovascular centers and neurovasculature, even ossification centers, it's just the active recall of, okay, if it's the calcaneus, it's this year and stuff like that. So it's just kind of pulling it up I don't know, just the biggest form of just doing that active recall where, okay, like you're not just passively reading something, you're seeing one part of it and then you can make the rest of the topic in your head. I think that's one of the best ways to do it.
Very good. So one of the questions I have, and this might be a little challenging to answer, but every year we deal with the amount of material and the amount of exams around finals time and the stress related to that, and how you balance how much time you put into one course versus the other, right? Because it makes no sense to get a 99% in one course and a 71% in the other. Have you been challenged by that at all? And if you have been, how did you deal with it, Rineeta?
I feel like that is a bit of a difficult question, but I think I just gradually see if I'm able to do my active recall, like Zach said. And if I'm having trouble with a certain class, then I'm assuming that I'm not doing too well in that one. So I want to have more time to that course. Whereas I'll have a different class, for example, the pediatric orthopedics class we have now, I'm able to recall a lot more of that information. So that tends to be the class I spend less time on. So it's just gradually seeing what works for me as I go about, and I try to test myself. So I'm not testing myself on the exam itself. I'm more so just testing myself as I go to see how I'm scoring in my own mind.
There you go. That's good. That's good strategy. Austin, have you experienced that at all?
Oh yeah, definitely. So I mean, I'm like all about lists. So I'll write out point distributions and I'll kind of figure out where the highest yield, like time input is, depending on what course that is and how difficult it is and how much content there is. Because we've had exams that were like 19 chapters long sometimes, like for neurology. Right. And that was a big one. Was like, well, how much time do I actually put into this? And I definitely prioritized a few other exams, and it turned out fine. But yeah, making a list is really important for me, and just analyzing the scores, like how much you can miss realistically and how much time you should put in. But yeah, just write it out, have a plan. That's probably all I have to say about that, but yeah.
Okay. We can delve into it a little further, but I'd love...
Yeah, the way I kind of think of it is you kind of just have to set up a goal for a class, right? Like what I tell incoming students when I interview them for our process is it's like, okay, well, if you want to be an A student, then that means you study different than a B student, right? So if you have a goal of, hey, I want to get an A in every class, and you're going to dedicate 3-4 hours a day to every class. But if you're comfortable just being a B student and you're okay with that, then you're obviously going to do 1 to 2 hours. So it's kind of just like the biggest thing I tell them is just set the goal that you want. If you want an A in this class and a B in this class, then set your study habits to that. Set maybe if you're going to do the class you want an A in, you look at that from Monday to Thursday, and then you just save the Saturday and Sunday for the class you want to be in. So that's kind of how I've just managed things is doing it. I mean, I want an A in every class, so I study 24 hours a day, but that's just me. Not everybody's like
But
that.
at the end of the day, there's only so many hours in a day.
Exactly.
And we all have to make choices. So sometimes that is a choice students have to make, how much they're going to study for each course. Audrey, have you experienced that at all?
I definitely have. And one thing is definitely knowing yourself. So for me, I found myself kind of putting off maybe studying for another class because I'm having more fun studying for the other one. And I'll overstudy for that class. And so I started writing down every single, I call them like chapters or lectures, like lecture 1, 2, 3 for this class on like a sticky note. And then I put a little check mark next to it once I do that. And then at the end of the week, I can look and see how many times I've reviewed each lecture for each of my different classes. And then you can have a good visual representation and see where you're really lacking in your check marks next to those lectures. So I liked that.
Those are all great processes. So one of the reasons I bring this up is because our current third years are taking boards tomorrow. And, excuse me, this is always a challenge because everybody feels like they're underprepared. And I just wanted to put everybody's mind at rest that if you get through the curriculum at the Arizona College of Podiatric Medicine, you're going to pass boards. And that's one way to look at it because it is thorough, it is in depth. I think sometimes we overteach some things, but I think it's worth it for the students in the long haul. And so I just wanted to share that. All right. Last question I had. I wanted to talk about your second year. Oh, two questions. What was it like to finish your first year? Remember we had the party and everything was good. How'd you feel when you finished the first year before going on vacation?
I mean, I just kind of couldn't believe it. I was like, wow, I've already been here for so long and we've really accomplished this and shown that we can do this. And I really hadn't realized how much time had passed. I was very surprised by that we've already been here for a whole year, but it's been really exciting.
A year goes by fast. Rineeta?
Yeah, I'm in a similar boat where it's just really exciting because you just kind of study for the test after test after test, and then finally having that break and the gala that we had to celebrate our first year, it finally put it into like mind that we finished our first year. We're 1 out of 4 done. And it was just kind of weird, but so exciting.
And it's the hardest year because it's the biggest shock to the system. Now, as you all know, it's kind of like rinse and repeat for different courses. Have you had the similar experience? What'd you think when you finished the first year, Austin?
Yeah, I distinctly remember finals week this spring, and it was pretty crazy because there's so much that I mentioned that exam with 19 chapters for neuro. That was intimidating me a little bit. But once we made it through that week, it was like really triumphant. It was like, well, we did it. You know, we're still here. We made it, and it kind of empowered a lot of us, kind of like, oh, we can do this, we can keep doing it, and it was pretty eye-opening. But yeah, it's great to see yourself adapt and overcome and become an even better student.
I love the word triumphant. That's great.
Yeah, I think that's a great way to say it. Like, I just remember like one of my favorite sayings is it's only impossible until you do it, right? Something's only hard until you achieve it. Like, I remember my first week of school, I was like, all right, let's get ready for the grind. Let's do it. And then you just get so lost in like just the tests and the curriculum and then everything. But then finally, once you get to the end of your first year, it kind of just brings everything back together. Like, oh, we just got through it. We're 3 years away from like having our DPM certificate. And then second years when we finally start seeing patients, like I bring it back to our classes. Like we have our pod skills class where we go out to private practices and homeless shelters and kind of start to practice the things we've learned. Like I remember like my first experience at the homeless shelter, I was like, oh, I remember this from this class. It's like it kind of just all groups everything together. So it's just like it's an exciting time. It kind of brings everything back together. It just kind of shows what you're working towards. And I think that's a great thing.
I think it's huge. And it's neat to have those carrots out there,
Yeah.
too, of course. All right, well, let's kind of get into the present then. You're second year students now. And all of that year of anatomy, learning all the terminology and orientation kind of comes to fruition with lower extremity anatomy and the lower extremity dissection lab. I'd love to delve into this further because I think it's probably the most important class we have because you can't really know your biomechanics until you know your anatomy, and you can't really be a great surgeon until you understand the biomechanics and how the foot functions. So let's talk about lower extremity anatomy for a few minutes. Austin, you mind starting?
Oh, yeah, definitely. Yeah, so lower extremity anatomy is a great course. I love it because in normal gross anatomy, we learn like the entire arm maybe in a week, all the musculature in maybe 2 or 3 lectures, and then we get thrown into the lab and we haven't mastered it. And we're kind of like tiptoeing around, kind of worried about cutting important vascular structures and stuff. But with lower extremity anatomy, it's really front loaded because we get all the content in the first half and then we go in and we can dissect in the second half with all that knowledge we have. So you're really comfortable. You know almost everything there is to know because we've been taught so well. And the exam scores have shown it too. I mean, everyone's doing pretty great, and it's a great course. But we have tending physicians come in all the time, podiatrists, and from all of them, I've heard that it's just such a great experience because even they come over, they look at the cadaver limbs, and they're like, this is a great refresher. It's like the gold standard for learning anatomy. There's nothing better. So I've loved it. It's been so much fun.
Well said. Zach.
Yeah, shout out to Dr. Wisman, who's the course director of that class. He does a really great job. So just from gen anatomy, it's the whole body to having our cadaver just from the hip down. It's a great way to just gain confidence in what you already know. Like I know it's, at least for me, like in our general anatomy course, like when we would go do the cadaver, you kind of know the stuff, but you need to go back and look at it. Now for lower extremity, you go in and exactly like, okay, we're doing the dorsum of the foot. I know that these muscles are here, these muscles are here. So it's just a great way to build your confidence in knowing that like, hey, I'm going to do like, we also do some like practice surgeries there and stuff like that. Like we did an ostium bunionectomy and then some arthroplasties. And so that was a really great experience too. So just building your confidence and saying, hey, this is like my level of expertise. I'm going to know every single thing about this. I'm going to know every single variant, every single vascular supply. It's just a great way to kind of just become confident in what you're going to do for the rest of your life. And so I think it's just an awesome course.
That is great because we are going further in depth on the anatomy of the foot than anyone on the planet, really. It's great. Audrey.
So this class has really helped me with making the material click now, especially for vasculature and nerves. I wasn't really seeing the pathway on just, a piece of paper. It's hard to conceptualize the 3D. And so this time I feel like I could finally see, oh, this makes so much more sense that it's all, this is the course of it. And I just feel like I have such a deeper knowledge now, and I'm so much more confident in it. And it really is, we were so well prepared for all of this. And so that makes it even better.
Very good. Rineeta.
Yeah, I do have to agree. I really enjoyed this course because it helped really put together all the material we learned. Our general anatomy course was such a great intro. We did only spend like a week and a half learning the lower extremity. And even then, our dissection was split into sections. For example, I think I could only do the posterior lower leg as well as the plantar foot. So we weren't able to make a full conception of everything that's going on because we were only constrained to that one section, and the rest we all had to do by just observation. So it's really nice to just be able to do the dissection ourselves and to just make those connections ourselves, like Audrey said.
I understand there's some competition for dissection because those limbs are being used on the exam, so everybody's got to have a great dissection. Do you sense that?
Yeah, well, I mean, you obviously want to do the limb as well as you can for yourself so you can see it, but you're not getting tested on your limb that you do. So yeah, you want to make sure everybody has a perfect dissection so that. So what's kind of cool. So for our lab final for this class is where we have to like take the muscles and pin them, whereas in the past for our general anatomy it was just like bubble sheet questions. So like this one will be more fun, just like a hands-on. Like to me, I don't even think it's going to feel like a test. It's just going to feel like a video game or like just a fun way of just, oh, I know this is here and this is here. So I think that'll be fun. But yeah, you obviously want to make it look like a netter image, which is how you study it, right? And so I tell my lab partner, I was like, oh, dude, this looks exactly like how we studied it. So I think it's perfect.
There you go. And how about surgical skills? I mean, you sense that you start to handle a blade and pick up.
Yeah, we used the sagittal saw for the bunionectomies too, and that was kind of like our first time using it on like an actual human foot. Right. And so I think that was really fun as well.
That was just a week ago. I was hearing good stories. Like everybody's got good hand skills, so it's good.
Good kind of way to practice it before you kind of do it in real life.
Always. No, you're going to be doing cadaver dissections as residents. And I remember when I was a resident, we weren't allowed to do anything, suture, soft tissue procedures, anything until we were cleared on cadavers and had assisted on X amount. So I think the learning process is appropriate and you're dosed accordingly. I mean, no different than the clinical experiences you have. Nobody's just throwing you to the wolves.
Yeah, I think the cadaver lab is really an excellent opportunity because you see the difference in the anatomy between like a male, a Caucasian male, or a smaller female and stuff. Like you can walk from table to table and just see. Like I know on my table we have a huge guy. This dude was probably like 7 foot because he's got just a ginormous foot, or some other tables have more petite feet and smaller feet. So I think that's really cool to kind of compare the muscle sizes and just kind of see, like, if you were to treat this patient in a clinic, how could you do this test versus this test based on your patient presentation? So I think the cadaver lab, it gives you a great opportunity of kind of just meshing everything together.
Well said. at this point, I thought maybe we would just go around the table and give our incoming class one piece of advice. All right? Rineeta, you start.
I think my biggest piece of advice is please have fun. You do not want to get burnt out, and I've definitely had experience of getting burnt out, and just being able to be with friends and not focus on studying was very valuable and kept me going through the past year.
Great advice. Austin?
Yeah. Have fun with it. Make it your job, but don't let it consume your life. Because I've definitely dealt with the burnout. Like first year, I would burn out way too often. So it's really important to prioritize your health and exercise and have a good support group. But other than that, yeah, just have fun with it. Push yourself a little bit, but not into the ground. But yeah, you'll do fine.
Very good. Zach?
It's really just your time management skills, like we were talking about. It's set a goal for yourself and have time management. Like I know, like when I first started, I was just like, we'll see how we go. And then I was like, it's like, okay, we're doing really good. And then that just becomes the standard of what you are. So just kind of set a goal and just have great time management skills.
Great advice. I give you the last word, Audrey.
My piece of advice would be to kind of be nice to yourself and understand that even if you didn't do well on one test, there's always a next one and you can come back from that. So
Great advice. Well, I look forward to continuing to do these quarterly. We've 3 episodes so far. I so appreciate your time and your energy and your thoughtfulness. And for all of our listeners out there, if you're listening on Apple Podcasts or Spotify, please give us a 5-star rating. And if you're watching on YouTube, become a subscriber. And we sure appreciate you listening in. So we'll do this again in 1 quarter. How's that sound?
Sounds great. Sounds like a plan.
And then I think next year, as we think forward, we'll get together after boards.
Okay. Yeah, sounds good.
And then we can do some reflection then, okay?
Awesome.
All right.
Yeah.
Cheers, everybody. All right. Bye-bye.
Good one, guys.
Thank you.